We're going to show you a range of motion assessment for the lats and the pecs. We can assess two different muscles in one go here, and we're looking for deviations away from normal. Now, a norm position should be that the arms come completely flat on the ground, completely straight overhead, and the upper arm can touch the ground without having a bend in the elbow, which we'll show you in a second. Now, I'm going to assess to see how Chris's range of motion is, and we're looking for two different deviations. One deviation will indicate more tightness in the lats, and a second deviation can show more tightness in the pecs. The way to do this is ask your client to bring their hands to a vertical position, so bring your hands up for me. Then you're simply going to lower them down rather than let them pull their arms down. Otherwise they will use their own muscle tension to get in a range of motion that's maybe not their normal resting position. So just relax for me. Okay, just relax. Now, we have some quite significant tightness here. What we should be seeing here is that, as I said already, the arms should be a straight line. Now we have a significant bend in both elbows. This indicates that Chris's pecs are tight. However, the upper arm is quite low to the ground. This one is actually touching the ground, this one's a little bit higher. So indicating there's also some tightness in his lats here, whereas this lat is quite good. I'm going to try and show you a couple of different positions that we're trying to get towards. Chris, can you actually try and, I don't know if you can get yourself in position or not, you might not be able to. Actually, you can't. The compensation that might happen, Chris, try and actually put your arms on the ground for me. Nice straight line. Now you notice the only way Chris can do that is by arching his back, because his lats insert all the way from the humerus here into his lumbar spine. Because he's got a lot of tightness there, if he was to flatten his back on the ground, the arms actually start to lift up. So we see that Chris actually has tightness in the pecs because of that bend, and tightness in the lats as well. Chris, if you'd like to sit yourself up, just out of frame for a moment, or just on, if you take a seat on the Bosu ball for me, I'm going to just lie down myself and actually show that position, and then I can kind of indicate the different compensations I'm looking for. So, if I look at the first compensation, again with the elbows bent, we'll show you where we should be in the ideal range. I can also then show you different compensations. Chris had quite a bit of tightness in the pecs there. Some people have less obvious tightness. So, ideally, range of motion should be that when our back is flat and our pelvis is nice and still, we can just lower the arms down towards the ground and they can just rest there. Okay, so this is ideal range of motion. I have a tiny bit of tightness in my pec on this side, but it's insignificant and we're looking for very obvious things here. Now, if we had a client who had very tight lats, you might see this. And I have seen some people that literally that's a range of motion. The lats did not allow any more range from here. So Chris was only a little bit up, so that's actually quite minor. However, Chris was more bent here when he relaxed. Although he could force himself higher up by stretching out muscles, we're looking for his resting tension, where he would sit at rest, and his pecs were quite tight here. You might see some people not quite as obvious, but remember, the ideal range is without a bend in the elbow, or very little bend, and the arms touch the ground. So with the bend, we're indicating tightness in the pecs. If the arms are off the ground, we're indicating tightness in the lats. We're just going to look at how much, depending on the severity of the compensations. So that's a very simple test to work out, is there tightness in the lats, is there tightness in the pecs, or is it both? And when we do some postural assessing, we can use this to help understand what we've seen in movement, well, what's actually happening when someone is in a relaxed position. And that's how we can paint the picture to build up an understanding of someone's tightness, but also weakness, so we can prescribe exercises to correct.